which is a discussion on establishing a city public health officer.
This is something that we in the office have been working on for probably a year now. We did some research, and what you have in your packet is a copy of the establishment of a city health officer that is in code in the city of Jefferson. What we've discovered is that in many cases, small communities in the state of Iowa are using the county sanitarian for assistance in making determinations not only in police matters but also in planning and zoning matters when it comes to making a determination about health, whether or not a scene is unhealthy or not. And what we've discovered is that in many of these cases, the sanitarians lack the medical expertise to make that type of determination, and of course that arises a real question about whether or not that could be held up in a court of law. One of the things that we are interested in doing, and we used to have this position, was about 20 years ago, Doc Uberg was actually the last person to serve as a city health officer, and the push has been is that we need to reestablish this position. But one of the things we discovered was that there was nothing in our code of ordinances actually creating the establishment of this position. It would have to be a newly created position. So what I'm asking the council is based upon what they've seen in their packet, and if we can find someone who's willing to follow, somebody who's willing to take the role, if this is something they would like to see drafted into our code of ordinances, that they have some suggested changes, some suggested, do they have any questions about why this might be something that we would want to see included? I will tell you that Terry Duffy, our zoning officer, has been pushing for this for a year now. He's been wanting to, he has been looking for the type of assistance in making these determinations.
We have found no other avenue to deal with this, other than if you did have the health officers. There certainly are some cases out there that would, I'm sure, would be helpful to John too in time. So
are you looking for this about? What do you think, John?
More for Terry's, I think it's written in the code for a lot of things that a health officer has to decide. It kind of ties his hands on a lot of calls he could be taking care of. I mean, for Terry's, I could definitely see, and occasionally I can see maybe we could use it, but...
If you run into a situation where you're making a determination of health, whether it's, a scene is healthy or not, to actually charge a person with a particular violation of city code, it would ease the process if you have somebody to help you make that determination, to assist you in making a determination that has some expertise to make that determination.
and these are council ordinances, not P&Z ordinances. They're council ordinances.
Correct.
So
Did you have somebody in mind?
Go around and start asking. I wanted to see first if you had some, if you had some different ideas, some different application for this. Are you have questions about whether or not this is actually a valuable asset to the city?
How many times do you think you've encountered a time when it would have been needed?
Well, we discussed this a little bit. I discussed this with John and Terry to some degree. We figured you're talking about the type of person that you might have to call in once every, based on what we've seen lately, once every couple of years to make a determination. It's not the type of scenario where you'd be using this person on a regular basis. Only when you step into a situation where health would be the paramount issue before you when you're making a determination of a violation.
did you talk to Sherry by any chance?
Sherry?
Wilson?
Yes.
And
Talked to her a couple of different
she
times.
isn't interested.
She was concerned about the limitations of her role, and also the limitations of her experience when it comes to matters of making a determination of health.
What about Sac County Health Services? Are they willing to do anything like that?
That's one of the avenues that we would discuss with them, the possibility of maybe performing this.
And that's,
Just trying to think of somebody that,
that's what I guess I would do, have you check around to see if there's Region 12 or somebody to see if there's a existing agency that,
Isn't there an agency within the hospital that we have in this community that we should be utilizing? The hospital should have someone
check with
in there
Mike.
for that
check
expertise.
something on, when you do with a.
When we have a
other
hospital,
deal,
we
you
should be
do that
using it.
Now, I know in a lot of larger cities, what they have is under their housing code. They've established a health officer, usually when they have unique housing codes. We don't have a unique housing code, so therefore, that wouldn't be the ideal location for us to be using that type of service. But that's one of the places that your larger communities tend to use this person for. But they usually have somebody on staff to actually perform that service.
So if we've gotten by without it for a year, we can probably spend a couple more weeks of research on camera.
Like I said, it's been, I guess we figured out Doc Uberg had been the last one, and it had been 15 or 20 years since he had performed that
Right,
in
with
the city.
Mary said, hospital, that's probably the best avenue they've got.
Yeah, and I wouldn't limit it just to, medical doctors, if one of the
Yeah,
PAs wanted
you
to.
might be able to do it, doctor.
No,
There you
I
go.
have vision, but not that
At least you see the problem.
kind.
That'd be double dipping. You can't do that.
Okay, we leave you to check out personnel,
Okay. I'll talk
At
to
this
the
time.
students.
okay?
And it probably wouldn't hurt if we get curious about this, have Terry come to a meeting and tell us really why he thought we needed it.
Certainly.